Hi, I'm Dr. David Cody, and in this video I'm going to be examining Susan's knee. Susan's been complaining of pain in both knees. Susan, thank you for coming in today. Have you got any problems with the knee at the moment, any pain?
They're both painful when I'm walking. I get like a grinding sensation with them.
Okay. So to start with, I'm just going to come to the bottom of the bed and just look at both legs and comparing one side to the other. I'm looking to see if there's any scars, any swelling, any muscle wasting. We can see a little bit of muscle wasting in the quadriceps, and I can see that she's not got this left knee quite flat down on the couch. I can see that the knees are fairly straight. There's no significant varus or valgus deformity that I can see. I'm looking also for some more general aspects of examination of the foot and ankle, and I can also have a look at Susan's hands as well to see if there's any problems. So Susan, I'm going to have a little feel if that's okay. I'm just going to start with temperature, just using the back of my hand, feeling across the joint, and the temperature feels normal, feels cool. Then I'm going to go on and examine for a joint effusion. So I'm going to do a patella tap. I'm pressing down on the suprapatellar bursa here, and then with my thumb I'm pushing down on the patella, or with 2 or 3 fingers. And I'm not getting any sense that there's any fluid in the joint when I do that. Just the same on the other side. So there's no bounce of the patella at all. And then I'm going to move on to the cross fluctuation or the bulge test. I'm going to sweep upwards from the medial gutter. So any fluids being pushed up into the suprapatellar. And then sweeping down the lateral side, and as I do that you can see a tiny bit of fluid appear in the medial gutter. So that's a very nice bulge sign that we're seeing. I'm going to do the same on the other side, sweeping round and down the lateral side, and I'm not seeing any fluid within the left knee when I do that. So next we're going to do some movements. I'm just going to pick your knees up if that's okay, Sue. So I'm just seeing if the knees fully extend when I do this, and I get the sense that the right knee is fully extended but the left knee isn't. And then I'm just going to bring your knee up if that's okay. So just bend it up slowly as far as it goes, and that's somewhat limited, and I can feel with my left hand on the kneecap, on the patella, I can feel crepitus. Is that as far as it will go? So it's quite significantly limited on the left, and I'm getting a sensation of a lot of crepitus and grating underneath my left hand. So I'm just going to bring the knee up to 90 degrees. I'm just going to have a further feel. So with this I'm using my 2 fingers, my thumbs, and I'm feeling round in the joint line for the swelling, which feels somewhat bony and hard. And I'm feeling the patella tendon for tenderness. I'm watching the patient's face as I do this, and also the top of the patella for insertional pain. Is that a bit tender? Okay. I'm feeling round into the hamstrings and the posterior fossa also. And again, I get the impression there's a little bit of tenderness there. While the knee's bent at 90 degrees, I'm going to do the anterior draw test. So to start with, I'm just going to see if there's any sag, which there isn't. I'm going to put my fingers onto the hamstrings and my thumbs on the tibia, and I'm just going to gently pull forward. Again, watching the patient's face, because sometimes this can be quite uncomfortable. But that feels very stable. And then I'm going to do the collateral ligament test with the knee just slightly flexed. I'm pushing with this hand and I'm testing the medial collateral here, and then the lateral collateral. And again, that's uncomfortable for the patient, but it feels stable. And I'd obviously do the same on the left knee. At this stage, I'm going to get Sue to stand up, and we're going to examine her again in the stance. So Sue, do you mind just getting off the couch there? Just take your time. That's great. And just a step forward for me. That's lovely. So with the patient standing again, I'm going to have another look for symmetry and fixed flexion of the knees. I can see there's a little bit of valgus deformity within the knee. I can see again the muscle wasting that she's got, and I can look at how she's weight bearing in the foot and ankle area also. So can I just get you to turn around for me so we can have a look at the back. So from behind again, I'm looking at the popliteal fossa area. I'm looking for muscle wasting within the calf, and again I'm looking at foot and ankle alignment. So Sue, can I just get you to take a few steps for me and turn around? So we're watching gait, and we can see that she's walking with her stick, so she obviously finds walking difficult and uncomfortable, quite slow and antalgic. That concludes the examination. Thank you, Sue. So to summarise, Sue's got a varus deformity of the knee with non-tender, hard bony swellings around both the left and the right knee. Full extension, particularly in the left, is limited, and flexion at both knees is significantly limited. There's crepitus throughout the full range of movement. The knees appear stable, although the patient walks with an antalgic gait and also with a stick. The diagnosis is one of osteoarthritis of both knees with a small effusion seen within the right knee.